Cervical cancer is one of the most preventable cancers, yet women are still dying from it. Let me explain. Hi, my name is Diana, Millennium, and I create content on health, lifestyle, and faith. Now, like many other cancers, cervical cancer does not start overnight. It develops gradually. Don't mind, I'm walking and I am from work, as you can see. I decided to follow this path because I find it to be shorter, and again, walking is my major form of exercise. So just viewing the nature, and walking along this road is more than enough. I'm enjoying it. Now back to the subject matter, which is cervical cancer. January is Cervical Cancer Awareness Month, and it's something that is spreading, or rather, I'd say there are better diagnostics in Kenya. That's why people are able to detect it or even treat it, and early detection is always the best, not just in Kenya, but in many other developing countries where health is rapidly growing, and that is a positive thing. Globally, cervical cancer is the fourth most common cancer in women, and in 2022 alone, 350,000 women died because of cervical cancer, and 660,000 were newly reported cases. Now here is the thing. Cervical cancer is highest in low and middle income countries, which reports the highest new diagnosis and deaths. You guys, recording on the road is very hard. Now look at me, struggling with tons of things on my handbag. But I'm glad there are fewer people. Now there are many buses passing along the road. I think kids are moving. They are coming back from school, and so kuna school buses mob zinapita pita. Yes, but generally look at this. You guys, I thought we'd find maize plantation in. See how they're growing well. This is nice. I guess when I grow up, just want to find a piece of land in a place like this. Look at that. Yeah, like it doesn't look like the real Nairobi. But there's a lot of dust. Anyway. Tumefika hapa, lakini simnichangie tu pesa ya gari sasa. Juu mbona nateseka kwa vumbi nikitry ku create content. Nimechapa na vumbi. But anyway guys, back to what you are discussing. What are the causes of cervical cancer? Now, cervical cancer is caused by persistent infection with human papillomavirus, and it is 6 times more common in women living with HIV compared to those who don't have HIV. Now guys, I'm tired. Hapa ni mlima. And I also have some dust on my head. The Maram Road explains it all. That will not deter us from finishing what we started. For example, look at this. Ooh, we? Look at that. I don't know whose gate is this, but like I was saying, cervical cancer is 6 times more common in women living with HIV compared to the women who do not have HIV. That is because they are also immunocompromised. Many countries are now accelerating their efforts to ensure that they are attaining the global 90 to 70 to 90 rule. Sana mambo. They are accelerating their efforts to ensure they meet the 90 to 70 to 90 rule, which means there should be 90% of girls vaccinated with the human papillomavirus vaccines by the age of 15, and then 70% of women aged 35 and 45 should be screened, and again 90% of women who have invasive cancer are given appropriate treatment. HPV virus is an infection that can affect the skin, the anal area, the genital area, and also the throat. Wadau umenifikisha kwangu. But anyway, we said it affects the skin, the throat, and it can also affect the anal and the genital areas. And the carcinogenic types. Carcinogenic means they're able to cause cancer. Now, the carcinogenic types of HPV is the short form of human papilloma virus. The carcinogenic types will lead to the development of cancer cells or abnormal cells that now lead to development of cancer cells. You get it? And this normally takes 15 to 20 years. 15 to 20 years. What increases the risk of developing cervical cancer? I don't mind the kids. So what increases the risk of developing cervical cancer? One is use of hormonal contraceptives. Number 2 is an immunocompromised state. Immunocompromised meaning the immunity is very low. We also have presence of other sexually transmitted infections. Wow. So the other one is young age at first pregnancy, and then the number of births generally, and also smoking. Smoking will also increase the risk of developing cervical cancer. Hi, you've gotten home with me. And now we are getting to the most important part that I want you guys to listen and listen carefully. The prevention part, because now this one involves all of us to take action. What are the ways in which you can prevent human papillomavirus or even the cervical cancer? Because it is the human papillomavirus that leads to the cervical cancer. Let's get into it. But before we get into that, kindly take a minute and subscribe to my YouTube channel, and also click the notification bell. If you have not liked, please like it, because it will enable other people to get this useful information, especially at this month of the year. We want to stay healthy. We want everyone to get the information, because sometimes, and most of the times, it's because of the negligence. It's because people do not know. So what are the ways of preventing this cancer? Number 1 is vaccination of girls aged 9 to 14 years. Now, normally the vaccination is with the human papillomavirus vaccine, and the doses are 1 to 2. It would be 2 if the susceptibility is high. Number 2 is having cervical cancer screening of women who are 30 years and above, and those who are 25 years and above, that is for women who are living with HIV, right? And also there is early detection. Early detection is for any woman of any age. Early detection of women with the symptoms. Now we'll get into the symptoms later on. Some countries have gone a step ahead. You'd find countries vaccinating even the boys, because if I had not mentioned this, human papillomavirus is sexually transmitted. So by vaccinating the boys, it means that you limit, or you rather reduce, the transmission of the human papillomavirus. So what are some of the signs of cervical cancer? Number one is increased or foul-smelling vaginal discharge, unusual bleeding between periods after menopause, persistent pain in the back, legs, or even in the pelvis, vaginal discomfort, swelling in the legs. Now, these are signs, and for you to be diagnosed, you have to go for the screening, right? You get me right? Yeah. We have time to prevent, time for the screening. If you're a woman watching this, please ensure you do that. Ensure you visit any nearest hospital and do that on time. Now, simple tests like pap smear and HPV screening will save your life. It will ensure early diagnosis and early prevention. Prevention is powerful, and if you get this information, please share it with other people so that they may also get to hear it and save lives out there. Otherwise, thanks for watching and have a beautiful day, evening, or whatever time you're watching it. Bye.